Hello everybody, good evening. Hope audio, video, everything is fine. So if everything is fine, let's begin with our session. Hello everybody, good evening. Yeah. So with that, as you know, today we have gathered here. Today we have gathered here to discuss the very important high yield topics for our upcoming INICET exam in the November 2023. With that, hope all of your preparations are going fine. Okay, and most of you have might finish the face-to-face classes. Those who are attending face-to-face classes, now you have to plan a revision, and many of you are texting me to make a plan for revision. Very soon I will give you a plan for revision, how to plan. For that, till now we focus on INICET November INICET. So till November, I said what to do. I will tell you at the end. Without any delay, first we start our topics, important high-yield topics, and then we can discuss at the end what to do and how we have to plan. So with that, let's begin with our session. I heartily welcome all of you to our session, that is high-yield topics for INSET. So with that, let's begin with the first topic which I want to discuss here. So the first topic which is important for INSET is the bacterial toxins and their actions. Here, many students they struggle to remember the bacterial toxins and their actions, right? But it is very, very important for INICET. And remember, toxins you have to remember with respect to their actions. That is the first point. Toxins you have to remember with respect to their actions. That is the first point. What you have to remember. So the second point is, there are four types of actions, right? The second point is, there are four types of actions. There are four types of actions. Give me a second. The second point is, there are four types of actions. Okay, for the four types of actions are, increase in cyclic AMP, increase in cyclic GMP. See, that is very easy to remember. Increase in cyclic AMP and increase in cyclic GMP. Very, very easy to remember, right? So next two topics, next two actions, inhibiting neurotransmitters, inhibiting protein synthesis. So first you have to realize, two mechanisms are acting by increasing. What is increasing? Cyclic AMP and cyclic GMP. And two mechanisms are inhibiting. What is inhibited? So neurotransmitters are inhibited and protein synthesis inhibited. That is the first thing what you have to fix in your mind. And once you fix this in your mind, now you have to realize there are two important toxins which act by increasing cyclic AMP, and there is one important toxin act by increasing cyclic GMP, and there are two important toxins act by inhibiting neurotransmitters, and there are four important toxins act by inhibiting protein synthesis. Now you have to fix in your mind the cyclic AMP, cyclic GMP, 2 plus 1, 2 plus 1, then inhibiting neurotransmitter, inhibiting protein synthesis, 2 plus 4. So remember 2 plus 1, 2 plus 4. You should not forget this. First, you have to remember the action, increase in cyclic AMP, increase in cyclic GMP. Then you have to remember inhibiting neurotransmitters, inhibiting protein synthesis. Then you have to fix in your mind 2 plus 1, 2 plus 4. Toxins. So 2 plus 1 is 3, 2 plus 4 are 6, 3 plus 6, 9 important toxins. So which are the two toxins act by inhibiting protein synthesis? So that is what I have given in the box. Box is very, very important. So what I have given in the box, I want to highlight with yellow color. So Bacillus anthracis anthrax toxin act by increasing cyclic AMP, Vibrio cholera toxin act by increasing cyclic AMP. So there is no need of mnemonic because there are only two toxins. Increase in cyclic AMP, anthrax toxin, cholera toxin. There are many more, but we are discussing important. And you know, anthrax toxin causes anthrax, cholera toxin causes cholera. But you also know that cholera toxin, right? Binds to GM1 ganglioside receptors of the intestine. and after binding to GM1 ganglioside receptor, it disrupts the zona occludens tight junction. Again, that is very, very important question for INICET. So now we are done with the two toxins which act by increasing cyclic AMP, anthrax toxin and cholera toxin. Act by increasing cyclic AMP. And with respect to cholera toxin, two important points have to remember. GM1, it binds to GM1 ganglioside receptors and it disrupts zona occludens tight junction. So done with the cyclic AMP, coming to the cyclic GMP. Sir, cyclic GMP, sir, Clostridium difficile, exotoxin A and exotoxin B. That is what you have to remember. Clostridium difficile, exotoxin A and exotoxin B. But what is more important here is, sir, Clostridium difficile is a commensal of the intestine. It is a commensal of the intestine. On prolonged use of antibiotics like ceftriaxone and clindamycin, and prolonged use of antibiotics like ceftriaxone and clindamycin, it becomes pathogen. When it becomes pathogen, it produces toxin exotoxin A and exotoxin B, which causes pseudomembranous colitis. These toxins act by increasing cyclic GMP. Every point is important. Sir, it is not just here to remember the toxins. If you have to just remember the toxins, I would have mentioned just the name of the toxins. Sir, just remembering the toxins, that you are focusing on one part in the exam. But other parts are also important. All those are questions. Sir, what is the predisposing factor for Clostridium difficile that converts commensal to pathogen? Your answer should be prolonged use of antibiotics like ceftriaxone and clindamycin. What does it cause? Pseudomembranous colitis. Sir, everything is important. With that, we are done with the one toxin act by increasing cyclic GMP, sir, that is Clostridium difficile, exotoxin A and exotoxin B in presence of prolonged use of antibiotics. So we are done with the first two mechanisms, increase in cyclic AMP, increase in cyclic GMP. Two toxins by cyclic AMP, anthrax toxin and cholera toxin. One toxin by cyclic GMP, exotoxin A and B of Clostridium difficile. So moving on to the next mechanisms. So if you talk about the next mechanism, we have inhibiting neurotransmitters and inhibiting protein synthesis. So inhibiting neurotransmitters, there are two toxins. the first is the Clostridium botulinum toxin act by inhibiting excitatory neurotransmitter. Acts by inhibiting excitatory neurotransmitter like acetylcholine and causes flaccid paralysis. That is what you call as botulism. Similarly, sir, Clostridium tetanospasmin act by inhibiting inhibitory neurotransmitter like GABA and glycine, which causes spastic paralysis, which is known as tetanus. Sir, easy to remember. Sir, both are Clostridium species. One is Clostridium botulinum, one more is Clostridium tetani. We know Clostridium botulinum causes botulism, which is nothing but flaccid paralysis. Clostridium tetani causes tetanus, which is nothing but spastic paralysis. Sir, Clostridium botulinum produces a toxin. Botulinum toxin act by inhibiting excitatory neurotransmitter acetylcholine, and Clostridium tetani act by inhibiting the inhibitory neurotransmitters like GABA and glycine. Sir, these are the two mechanisms. These are the two toxins which act by inhibiting neurotransmitters. Now moving on to the last part. So toxins act by inhibiting protein synthesis. There are four toxins. So to inhibit protein synthesis, we have to inhibit either EF2, elongation factor 2, or we have to inhibit ribosomes. Either EF2 or ribosomes. So there are two toxins which act by inhibiting EF2, elongation factor 2, and inhibit protein synthesis, and there are two toxins which act by inhibiting ribosomes and inhibiting protein synthesis. So first we focus on EF2. Sir, EF2. Sir, once we say inhibition of EF2, the one toxin that comes to our mind is, sir, Corynebacterium diphtheria toxin, right? If you have studied, you might be knowing it. This is the first toxin that has to come, and that will come into our mind. That Clostridium Corynebacterium diphtheria toxin causes diphtheria, act by inhibiting EF2, elongation factor 2. Similarly, one more toxin what you have to remember is Pseudomonas aeruginosa exotoxin A is also act by inhibiting elongation factor 2. See, along with diphtheria, you have to remember Pseudomonas. Fix this in your mind. Diphtheria, Pseudomonas act by inhibiting EF2. And finally, sir, inhibiting ribosomes. If ribosomes are inhibited, then also protein synthesis is inhibited. Sir, easy to remember the two toxins. The two toxins are EHEC, that is enterohemorrhagic E. coli O157H7 serotype produces a toxin, Verocytotoxin, and Shigella produces a toxin, Shiga toxin, and both of them they cause dysentery and HUS. HUS means hemolytic uremic syndrome. Because both these toxins they cause same diseases, dysentery and hemolytic uremic syndrome. That's why you might be knowing it. I don't know. Verocytotoxin is also known as Shiga-like toxin. Verocytotoxin is also known as Shiga-like toxin because it is like Shiga toxin. Because both of them they act by inhibiting ribosomes, and both of them they cause dysentery, and both of them they cause hemolytic uremic syndrome, and that's why verocytotoxin is also known as Shiga-like toxin. So easy to remember: Shiga-like toxin and Shiga toxin inhibit ribosomes. Diphtheria and Pseudomonas inhibit EF2. Clostridium botulinum and Clostridium tetani inhibit neurotransmitters. The anthrax toxin and cholera toxin increase in cyclic EMP. Clostridium difficile exotoxin A and B act by increase in cyclic GMP. So with that we are done with the toxins and their action. 2 plus 1 and 2 plus 4. So 9 toxins we have completed. They look like one topic. It looks like we have completed one topic. But how many toxins we have completed? 9 toxins produced by 9 different organisms. 9 toxins, 9 different organisms. Very, very important topic. Very, very important topic. The Clostridium difficile is INICET people ka favorite. Vibrio cholerae is favorite. Sir, what? Then diphtheria toxin action is favorite. Sir, most of the toxins they ask repeatedly. This is a very important, most common repeated topic, toxin and their action. So today I'm here not just to deliver these are the toxins, take the mnemonic and remember it. No. So today I'm here to tell you people how to remember also. Right? So without mnemonic, we are remembering it, and all the importance we have covered here, and we know the toxin, you know the action, you know the organism, you know the disease also, you know everything what is needed. So with that we are done with the first topic. Though the topic is 1, we have completed 9 bacteria producing 9 toxins. So moving on to the second topic, important vectors. We always struggle to remember vectors because we have many vectors, but I am not discussing all the vectors here. I am discussing the 3 important vectors which are INICET people's favorite of INICET people. Sir, 4 important vectors. Sir, which are the 4 important vectors? If you see the first vector, I hope it is very, very easy and hope everybody can identify. I don't know whether you will identify or not. Sir, this is what? This is hard tick. Sir, this is hard tick. This is hard tick. No, everybody knows it. This is hard tick. And everybody knows one more thing. What is that, sir? Hard tick is also known as ixoid tick. Very, very important. Hard tick is also known as, sir, how to identify this is hard tick? Sir, that is also most of you might be knowing. Sir, there is a triangular plate on the dorsum of the tick. Sir, if there is a triangular plate like this on the dorsum of the tick, sir, this is hard tick or ixoid tick. Sir, this is the most common asked question in the examiner's favorite, man. Hard tick, very, very favorite. So here I have divided the diseases based on what, sir? Based on bacteria, viruses and parasite. Bacteria, viruses and parasite. So 3 important bacteria. So Rocky Mountain spotted fever, Mediterranean spotted fever, Lyme's disease. Okay, RML. Right, if you want a mnemonic, RML. Right, RML. It's a very famous college, in Delhi. RML. So Rocky Mountain spotted fever, Mediterranean spotted fever, Lyme's disease. If you want to make mnemonic, you can make any. Hard tick is very hard. Rock is very hard. And lime juice I'm making, in which I'm asked what adding rock salt, floating on in the Mediterranean, in the middle of the Mediterranean Sea. Man, if you want to make mnemonic, if you want stories, you want any story you want to, you can make. But what I say is better avoid the mnemonics and stories as much as possible, unless until they are not related. So just the Rocky Mountain spotted fever, Mediterranean spotted fever, Lyme's disease, RML. So Rocky Mountain spotted fever is caused by Rickettsia. Mediterranean spotted fever is caused by Rickettsia conoria, and Lyme's disease is caused by Borrelia burgdorferi. Sir, here organism names are not important. What is more important is, sir, disease names. That's why I'm focusing on disease name. RML, transmitted by hard tick. These are the 3 bacterial diseases. R for Rocky Mountain spotted fever, M for Mediterranean spotted fever, SF means spotted fever, and Lyme's disease caused by Borrelia burgdorferi. And Lyme's disease is a disease that manifests with what? That manifests with a rash which look like this. The rash is known as target rash, which is also known as erythema migrans. This rash is also known as target rash. You already know, very, very important, target rash, which is also known as erythema migrans. So these are the 3. Remember which are the 3 bacteria transmitted by hard tick. If you are my student, you have to say RML, R for Rocky Mountain spotted fever, M for Mediterranean spotted fever, L for Lyme's disease. So 2 important viruses, KFD and CCF. So KFD means Caisseneur forest disease virus, CCF means Crimean Congo fever virus. See, KFD means Caisseneur forest disease virus because it is originated in the Caisseneur forest, which is situated in Karnataka, man, my place. Okay. So KFD virus started in my place. You just remember Naseer sir means KFD virus because it started in my place, Karnataka. I am from Bangalore, so Karnataka. And CCF, sir, CCF is originated in Crimean Congo fever virus. Means it is originated in Crimea and Congo. Crimea is a place in Australia. Congo is a place in Africa. It was originated in Australia and Africa in the place Crimea and Congo. That's why it is named as Crimean Congo fever virus. But in India, it is most commonly seen in Gujarat. In India, it is most commonly seen in Gujarat. Right. So two viruses, KFD and CCF. KFD and CCF. Right. KFD in my place, Karnataka, and CCF is in Gujarat. CCF is in Gujarat. So remember, these are the two viruses. Very, very important. Again, very, very, very important. And parasite, one parasite transmitted by KFD, sir, Babesia. Babesia. You know that everybody knows. Babesia means one thing that has to come to your mind, and hope it will come to your mind. I don't know what will come to your mind when you hear Babesia, but what has to come to your mind when you hear Babesia is Maltese cross. Right, what has to come to your mind when you hear Babesia is Maltese cross? So that is how you identify what is Maltese cross. Sir, within the RBCs, Babesia is present. Sir, within the RBCs, Babesia is present like a cross, which you see in the peripheral blood smear, Maltese cross, which is nothing but merozoite form of Babesia. That's how you identify Babesiosis, Maltese cross. You know, that has to come to your mind when you hear Babesia. It is transmitted by heart tick. Sir, now remember, so three bacteria. Now you have to remember, so three bacteria, two viruses, and one parasite. See, I'm highlighting so much because it is that important. I'm highlighting so much because it is that important. Very, very important. Okay, so never forget diseases transmitted by heart tick. Very, very important. Sir, I can put 3 stars. Most commonly asked. Very, very important. Very, very important. Okay, sir, bacteria means you have to tell R and L, R for Rocky Mountain spotted fever, M for Mediterranean spotted fever, L for Lyme's disease, and two viruses, KFD virus and CCF virus. KFD virus and CCF virus, and both of them cause VHF. VHF means what? Viral hemorrhagic fever. Viral hemorrhagic fever. And remember, KFD virus is most commonly seen in southern India, Karnataka, and CCF is most commonly seen in Gujarat, and Babesia, which is diagnosed by Maltese cross. Sir, so easy, man. 3 plus 2 plus 1, 3 bacteria, 2 virus, 1 parasite. So then what you see here is, louse. Now this is louse. Louse, so everybody knows, man. Everybody might have seen the louse, right? So louse are epidemic typhus, trench fever, and epidemic relapsing fever. See, there are two words which are known as epidemic. Sir, epidemic typhus, epidemic relapsing fever, trench fever. Trench fever. So these are the three bacterial diseases. Which are transmitted by louse. Sir, in that I want to highlight one epidemic typhus, which is very, very important. Sir, others also you have to remember. If you remember, it is better. If you remember, so if you want a mnemonic, you can say louse T. You can say louse T. Okay, not T-E-A-T, T, right? If you want, you can make any mnemonic, man. I can make better mnemonics. But rather than making mnemonics, it is better to remember louse means you have to remember epidemic. That is better to remember. No, louse means epidemic. Epidemic. So epidemic means epidemic typhus and epidemic relapsing fever. Epidemic typhus caused by Rickettsia provozeki and epidemic relapsing fever caused by Borrelia recurrentis. One more is trench fever. Trench fever caused by Bartonella quintana. But if you forget remaining other two also, it's okay. But what you should not forget is epidemic typhus. That is what is important. Remember epidemic typhus, epidemic relapsing fever. Trench fever, you forget it off. Not that important. Epidemic typhus, epidemic relapsing fever. The epidemic typhus, epidemic relapsing fever. You remember the two things. That is enough and easy to remember. Disease names are important. Okay, disease names are important. Okay, not the bacterial names. That's why I'm highlighting the disease names. So this is also important. KFD, CCF, Babesia is also very important. So in TICTO all are important, but here louse means remember epidemic. Louse means louse causes epidemic. That is the better mnemonic. Louse causes epidemic. What epidemic? Epidemic typhus and epidemic relapsing fever. Right? So that is my better mnemonic rather than your louse causes epidemic. Louse causes epidemic. That is the better mnemonic if you want. What epidemic? You two epidemics, epidemic typhus and epidemic relapsing fever caused by Rickettsia provozeki. And then what do you see in the last is, okay, what do you see in this? Now it is a louse. Now it is a louse. And finally, what you see here is this is sandfly. Sandfly is a transparent fly, look like sand. Right? The red color, what you see is the blood which it has taken as a meal from you, right? And here, what you see is rat flea. What you see is rat flea. Right? Sandfly means the one that has to come to your mind is obviously it has to come. Everybody know it is leishmania, right? Sandfly transmit leishmania. And rat flea, everybody knows Yersinia pestis causing plague. And one more is endemic typhus by Rickettsia typhi. The rat flea. Sir, again, endemic typhus is not that important. I will remove the highlighter. So remember, sandfly, leishmania, and rat flea plague. So there are many vectors, but these are the four very important vectors which I have highlighted here and have showed you how to remember. Sir, hard tick. First remember RML bacteria. Okay, what is the mnemonic? Hard tick. Sir, hard tick you have to remember the mnemonic as RML bacteria. Sir, what is RML bacteria? R for Rocky Mountain Spotted Fever, M for Mediterranean Spotted Fever, L for Lyme's disease. Two viruses. No mnemonic, you just have to remember KFD virus, CCF virus. And you have to remember both of them because viral hemorrhagic fever and KFD is seen in my place, right, India, and CCF is in Gujarat in India. Sir, Babesia, you know, Maltese cross, you know it is. Sir, then louse causes epidemic, that is the mnemonic. What epidemic? Epidemic typhus and epidemic relapsing fever. Sandfly, leishmania, rat flea plague. Easy to remember. So now I have given you all the toxins with their action and have showed you how easy it is to remember. I have showed you the second topic and there I have showed you how it is easy to remember. So here, so though you see 1, 2, 3, 4, there are 4 vectors, but you see how many organisms we have covered. So 3 plus 2 plus 1, 6 with the exodid tick, right? Then 6 plus 3, 9, 9 plus 1, 10, 10 plus 2, 12. Sir, we have covered here 12 bacteria, 12 organisms, right? So toxins, they act by 4 mechanisms, but we have covered 9 toxins by 9 bacteria. So vector, important vector, I have showed you only 4 here, but with that 4 important vector, we have covered how many organisms? Sir, 12 organisms. 12 organisms. In the last, I'm giving you only 12 topics today, only 12 topics. But don't see it as just 12 topics. That is what I'm trying to tell. Don't see it as just 12 topics. Man, a lot of things are hidden here. There are many organisms you are going to cover and you will enjoy it. And not only we are going to cover all the important points in one place, easy to remember, and I will show you how it is easy to remember without using much or many mnemonics. So with that, we are done with the second topic, important vectors. So toxins and vectors. So moving on to the next topic, very important for INICET meningitis. Meningitis. Sir, entire meningitis have brought it here in front of you in just one single page. Sir, this is entire meningitis. This is entire meningitis. So first you need to know how to identify meningitis. For that, everybody knows, sir, meningitis is nothing but inflammation of meninges manifest with signs of meningeal irritation. You know, we have 3 signs of meningeal irritation. Which are the 3 signs of meningeal irritation? So the first one is neck stiffness. Neck stiffness is the very important sign of meningeal irritation. If it is there, confirmed it is meningitis. And the second sign is Brudzinski sign, and the third sign is Kernick sign. Right, so neck stiffness, Brudzinski sign, and Kernick sign. Right, so other 2 signs I have not written here. If you want, I can write. Sir, why you didn't write the other 2 signs? I didn't write the other 2 signs because other 2 signs are also used by the examiner, but the most important sign used by the examiner is neck stiffness. Right, neck stiffness. Okay, somebody said, sir, phlebotomous, recent MCQ. Okay, fine. Right, sandfly is also known as phlebotomous. You just have to remember sandfly is also known as, yeah. So we'll come back to this because you people have told. I just want to tell that sandfly is also known as phlebotomous, and rat flea is also known as Xenopsilla chiopis. Right, sandfly is also known as Xenopsilla chiopis. Okay, sandfly is also known as phlebotomous, and rat flea is also known as Xenopsilla chiopis. Okay, thanks for reminding, very important. Other names are not important, then I wouldn't have mentioned, I would have ignored that. But this is very important. Sandfly, phlebotomous, rat flea, Xenopsilla chiopis. Okay, Xenopsilla chiopis. Okay, so with that, now we were discussing what, sir? We were discussing meningitis. I was telling first you should able to identify meningitis, and we are here in a state to identify meningitis because we know the manifestations of meningitis: neck stiffness, Kernick sign, and Brudzinski sign. Sir, once you have understood this, you have to realize, sir, meningitis we broadly classify. Meningitis is most commonly caused by bacteria. And bacterial meningitis is further classified into acute bacterial meningitis, which is also known as pyogenic meningitis, neonatal meningitis, and finally chronic bacterial meningitis. So meningitis is further classified into acute bacterial meningitis, neonatal bacterial meningitis, and chronic bacterial meningitis. And you know, CSF analysis picture is very important. Sir, I want to highlight the CSF analysis picture. Sir, in acute bacterial meningitis, which is also known as pyogenic meningitis, you see what? Sir, increase in neutrophil, decrease in glucose. Remember, highly elevated neutrophils, highly decreased glucose, right? Sir, if you remember me, Dr. Naseer, sir, meningitis, acute bacterial meningitis. First thing what you should not forget is, sir, it is also known as pyogenic meningitis. You should not forget. Very important. When you hear the name pyogenic meningitis, you should not forget it is also known as acute bacterial meningitis, pyogenic meningitis. And immediately CSF analysis, which you have to remember, sir has told like this. So remember this action: highly elevated neutrophils, highly decreased glucose. कुछ तो ज्यादा बढ़ गया, कुछ तो ज्यादा कम हो गया. What is the one that has increased very high? Neutrophils. What is the one that has decreased very low? Sir, glucose. Increase. Sir, highly increased neutrophil, highly decreased glucose. This is how you have to remember. Whereas neonatal bacterial meningitis, sir, that is also, sir, neonatal bacterial meningitis is also acute bacterial meningitis. It is also acute bacterial meningitis. Therefore, highly elevated neutrophils, highly decreased glucose. Same है यार, acute है, दोनों acute है. But chronic bacterial meningitis, you have to remember highly elevated protein. Highly elevated protein. And highly elevated protein precipitate due to gravity. अब जो precipitate हुआ है, that looks like a cobweb, and we call it as cobweb formation. The precipitated proteins due to gravity form a web-like formation, gives a web-like formation, forms a web that is known as, right? That is known as, right? That is known as what? Cobweb formation. Right? This is the first thing you have to remember. Once again, I'm telling you, acute bacterial meningitis, also known as pyogenic meningitis, highly elevated neutrophils, highly decreased glucose. Neonatal meningitis is also known as acute. It is also acute bacterial meningitis. That's why highly elevated neutrophils, highly decreased glucose. Whereas chronic bacterial meningitis, sir, highly elevated protein, which precipitate due to gravity and gives cobweb formation. Once you remember this, now I want to highlight the organisms, the bacteria causing meningitis in green color. Sir, acute bacterial meningitis is caused by pneumococcus, meningococcus, haemophilus influenzae B. Right? Again, no mnemonic, you have to remember directly. Easy to remember. देखो pneumococcus, meningococcus. Easy है ना? Pneumococcus, meningococcus. और देखो haemophilus influenzae B. So pneumococcus, meningococcus, haemophilus influenzae B. These are the three bacteria which causes acute bacterial meningitis. To identify these bacteria, key points are given in the box. And these boxes, I call them as magical boxes. याद रखो यार, Naseer sir's magical boxes. इसको याद रखो. Naseer sir's magical boxes. Right? These boxes are magical boxes. Remember, these boxes will. So tomorrow the question will come. A patient is suffering from meningitis. CSF sample was taken. CSF sample was taken, and CSF sample showed. CSF sample showed gram-positive cocci in pairs, which is optochin sensitive, bile soluble inulin fermenter. Man confirmed it is pneumococcus. हो गया man, pneumococcus. इस तरह से क्वेश्चन आएगा, इस तरह से आंसर करना है. This is how the question is going to come, and this is how you people have to answer, guys. Okay, sir, a patient is suffering from meningitis. CSF sample was taken, and CSF sample showed a gram-positive cocci, which is optochin sensitive, bile soluble inulin fermenter. Confirmed it is pneumococcus. So patient is suffering from meningitis. CSF sample was taken. CSF sample showed gram-negative cocci in pairs, which had been grown on Thayer Martin medium, and it is a maltose fermenter. हो गया man, meningococcus. Always tell students, remember M for M. Meningococcus is a maltose fermenter, and you know one more name of meningococcus is Neisseria meningitidis, and the selective culture media for Neisseria is Thayer Martin medium. If the question comes, a patient is suffering from meningitis, CSF sample was taken, and CSF sample showed GMCB. GMCB means gram-negative Coccobacilli, which shows pleomorphism on gram stain and satellitism on blood agar. Man, हो गया hemophilus. This is how the question is going to come. This is how you have to answer. Man, हो गया acute bacterial meningitis. Sir, acute bacterial meningitis, sir, highly elevated neutrophils, highly elevated glucose. ये है first point जो आपको पता होना चाहिए. Sir, once you know this, then you need to know the three bacteria causing acute bacterial meningitis. Sir, which are the three bacteria causing acute bacterial meningitis? Then you have to say pneumococcus, meningococcus, and haemophilus influenza B. Then how can you say this is pneumococcus? Then you say, sir, pneumococcus is gram-positive cocci in pairs, which is optochin sensitive, bile soluble inulin fermenter. Meningococcus is gram-negative cocci in pairs, which grow on Thayer Martin medium, and M for M, meningococcus is a maltose fermenter, and haemophilus influenza B is a gram-negative Coccobacilli that shows pleomorphism on gram stain and satellitism on blood agar. तो हो गया haemophilus. These are the key points used by the examiner in framing the questions, and this is how you have to answer. So with that, we have completed acute bacterial meningitis. We are moving on to the neonatal bacterial meningitis. Remember, neonatal bacterial meningitis is also acute bacterial meningitis. Therefore, CSF analysis picture is same like acute bacterial meningitis, highly elevated neutrophils and highly decreased glucose. So now, which are the three bacteria which causes neonatal meningitis? Sir, group B, Streptococcus, E. coli and Listeria. Sir, for this we have a universal mnemonic, and that universal mnemonic is, sir, that universal mnemonic is BEL, Bell bacteria. Sir, Bell bacteria causes neonatal meningitis. And remember, the bacteria which causes neonatal meningitis are the bacteria that also causes neonatal sepsis. Very important question in entrance exam. Neonatal meningitis. So they जो bacteria neonatal meningitis करते हैं ना, first they cause neonatal sepsis. What is sepsis? Blood infection. Blood infection. So first they cause blood infection in neonates, and from there they crosses the blood-brain barrier, they damage the blood-brain barrier and enter the brain, and they cause meningitis, neonatal meningitis. So remember, the bacteria which causes neonatal meningitis, they also cause neonatal sepsis. And we have a universal mnemonic to remember the bacteria causing neonatal meningitis, Bell bacteria. So if you are my student, if somebody asks you which bacteria causes neonatal meningitis, right, neonatal meningitis, then you have to say Bell bacteria causes neonatal meningitis. What do you mean by Bell bacteria? Sir, B for group B, Streptococcus, E for E. coli, L for Listeria. Now the question is, how can you say it is group B, Streptococcus? Sir, if the examiner says a child is suffering from neonatal meningitis, CSF sample showed the organism which is gram positive cocci in chains and CAM test positive, confirmed it is group B, Streptococcus. CSF sample showed gram negative bacilli. Sir, probably E. coli. If it is a neonate, gram negative bacilli, probably E. coli. If it is a gram positive bacilli showing differential motility, sir, Listeria. What is differential motility? As the name says, differential motility means difference in motility with respect to different temperatures. Difference in motility with respect to different temperatures. Okay, different in motility with respect to different temperatures. Okay, I just want to know that there is a voice disturbance for all. If there is, please let me know. Okay, sir, group B. Okay, I was telling differential motility means difference in motility with respect to different temperatures, right? Like 22 degrees Celsius, Listeria is motile at 22 degrees Celsius, showing tumbling motility, motile at 22 degrees Celsius, showing tumbling motility. Okay, let's see. Hope that voice disturbance won't be there. Let's see. Okay, with that, what I was telling was, okay, voice disturbance won't be there. Let's see. Okay, with that, what I was telling was, okay, okay. Sir, motile at 22 degrees Celsius showing tumbling motility. Motile at 22 degrees Celsius showing tumbling motility and becomes non-motile at 37 degrees Celsius. And become non-motile at 37 degrees Celsius. So motile at 22 degrees Celsius showing tumbling motility Celsius and become non-motile at 37 degrees Celsius. Hello. Okay, everybody, if possible to adjust, you can adjust. But if there is a major issue you're not able to follow, then please let me know. Okay. So with that, this is how we diagnose neonatal bacterial meningitis. Now moving on to sir, chronic bacterial meningitis. Okay. So chronic bacterial meningitis, sir, first you need to know the CSF analysis. I've told you CSF analysis is highly elevated protein precipitate due to gravity showing cobweb formation. And one important bacteria, sir, one important bacteria that causes chronic bacterial meningitis is, sir, Mycobacterium tuberculosis. Sir, how can you say it is Mycobacterium tuberculosis? Sir, now examiner will say a patient is suffering from meningitis. Patient is suffering from meningitis. The CSF sample showed the organism, and the organism is acid fast and non-filamentous CB-NAT positive and IGRA positive, confirmed Mycobacterium tuberculosis. Sir, with that we have completed meningitis. The entire meningitis now in one place. Entire meningitis is now in one place. Acute bacterial meningitis, neonatal meningitis, and chronic bacterial meningitis. And once again, guys, acute bacterial meningitis is also known as pyogenic meningitis. CSF analysis, highly elevated neutrophils, highly decreased glucose. Three bacteria: pneumococcus, meningococcus, haemophilus influenzae B. So pneumococcus, so gram-positive cocaine paste, octochin sensitive, bile soluble inulin fermenter. Then meningococcus, gram-negative cocaine paste, grown on Thayer Martin medium and maltose fermenter. Don't forget M for M. Haemophilus influenzae B, gram-negative cocoa bacilli with pleomorphism on gram stain and satellitism on blood agar. Sir, ये हो गया acute bacterial meningitis. If you talk about the chronic, sir, neonatal meningitis. Sir, first you have to remember neonatal meningitis is like acute bacterial meningitis, so highly elevated neutrophils, highly decreased glucose. And neonatal meningitis causing bacteria, they also cause neonatal sepsis. Neonatal sepsis. Three important bacteria. How to remember? Bell bacteria causes neonatal meningitis and neonatal sepsis. What do you mean by Bell bacteria? Sir, group B Streptococcus, E. coli, and Listeria. How can you say it is group B Streptococcus? Gram-positive cocaine chains with CAM test positive group B Streptococcus. If it is gram-negative bacilli, sir, E. coli. And if it is gram-positive bacilli showing differential motility, motile at 22 degrees Celsius, showing tumbling motility, and becomes non-motile at 37 degrees Celsius. Differential motility, sir, Listeria. Sir, chronic bacterial meningitis are highly elevated protein cobweb formation. And one bacteria, sir, Mycobacterium tuberculosis. Tubercular meningitis is chronic bacterial meningitis. How can you say it is Mycobacterium tuberculosis? Acid fast, non-filamentous bacilli, CB-NAT positive, IGRA positive. IGRA means interferon gamma release assay. Interferon gamma release assay. Sir, entire meningitis picture is there in front of you. Hope you enjoyed meningitis. Like this kind of picture, nowhere you get. Like this kind of picture, nowhere you get. Right? Nowhere you get. Okay, sir, once we are done with the meningitis, sir, now which is the most common bacteria causing acute bacterial meningitis? The most common bacteria causing acute bacterial meningitis is pneumococcus. 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 Right? And the most common bacteria causing neonatal meningitis, sir, most common in the world causing neonatal meningitis is group B Streptococcus, and most common in India causing neonatal meningitis is E. coli. And most common cause of chronic bacterial meningitis is Mycobacterium tuberculosis. See, now I have told you the most common. That is also very important. So the most common causing acute bacterial meningitis is pneumococcus. The most common causing neonatal meningitis. In the world, it is group B Streptococcus. In India, it is E. coli. And most common cause of chronic bacterial meningitis is, sir, Mycobacterium tuberculosis. Right? If you feel, wow, this is the moment where you have to say, wow. Okay, let's say, wow. So with that, moving on to our next topic. So the next topic is genital ulcerative disease. So genital ulcerative disease mainly caused by bacteria, and there are four bacteria, right? Mainly caused by bacteria, and there are four bacteria which causes genital ulcerative disease. Sir, I want to highlight those four bacteria first. Sir, Klebsiella, granulomatis, Haemophilus ducreyi, Treponema pallidum, and Chlamydia trachomatis. Sir, first you have to remember the bacteria. Sir, how to remember the bacteria? If you are my student, then you have to remember very simple. No mnemonic. You have to remember 2 plus 2. Sir, divide and remember 2 plus 2. Klebsiella, granulomatis, and Haemophilus ducreyi, Treponema pallidum, and Chlamydia. Sir, if you are my student, you have to remember first 2 are Klebsiella, Haemophilus, Klebsiella, Haemophilus, Klebsiella, Haemophilus. Right? Klebsiella, Haemophilus. Sir, Klebsiella causes granuloma inguinale. Klebsiella granulomatis. I always tell students, remember, granulomatis causes granuloma inguinale. Granulomatis causes which is also known as Donavanosis. When I ask students, Donavanosis caused by which bacteria? They say Leishmania donovani. Here, first of all, Leishmania donovani is not a bacteria; it is a parasite. I asked you which bacteria causes Donavanosis. Then if you say Leishmania donovani, you have to understand Leishmania donovani is not a bacteria; it is a parasite. The Leishmania donovani causes Leishmaniasis. Donavanosis is also known as granuloma inguinale, which is caused by Klebsiella granulomatis. And you know, Haemophilus ducreyi causes a disease chancroid, and Treponema pallidum causes a disease syphilis, and Chlamydia trachomatis causes lymphogranuloma venereum, which is known as LGV. Okay, done. So first you have to fix the names of the organism and also the names of the diseases caused by them. Very, very important. Names of the organism and also names of the diseases caused by them. Then you have to tell the genital ulcer. Sir, genital ulcerative diseases, remember, they manifest with genital ulcer. They manifest with genital ulcer and they manifest with lymphadenopathy, and which we called as buboes. Lymphadenopathy. Enlarged lymph nodes are also known as buboes. Enlarged lymph nodes are also known as buboes. Now you have to describe the genital ulcer and the buboes, whether there or not, if they are there, painful or painless. Painful or painless. The first point I want to highlight here is the pseudobuboes. Sir, if you see pseudobuboes, Klebsiella granulomatosis, that is the key point. That is the key point. Sir, when you hear pseudobuboes, false lymph nodes, say Klebsiella granulomatis. Then sir, ulcer is also painful, buboes are also painful. Painful is Haemophilus. ये याद रखना है. Painful कौन है? Haemophilus. Sir, Haemophilus is painful. Sir, whereas syphilis, painless ulcer, painless buboes. Sir, syphilis is painless. Syphilis is painless. Then Chlamydia trachomatis, painless ulcer but painful buboes. Painless ulcer, but sir, very simple. Ultimately, what I want to tell is, sir, if I see pseudobuboes, I can say it is Klebsiella granulomatis. If I say painful ulcer and painful buboes, both are painful. Sir, Haemophilus ducreyi, chancroid, sir, both are painless. Both are painless. Sir, it is Treponema. If one is painful, one is painless. Right? One is painful, and one is painless. Sir, one is painful and one is painless. Then I say it is Chlamydia trachomatis. Sir, this is how you have to remember. Sir, very easy. No mnemonic. No mnemonic. Sir, once again I'm telling you, Klebsiella granulomatis, pseudobuboes, Klebsiella granulomatis, painful, Haemophilus is painful, painless, syphilis is painless. One is painful, one is painless, sir, Chlamydia trachomatis. This is what you have to remember. Somebody said just now here safety pin appearance. Okay, I didn't mention it, not that important, but because you mentioned, I want to tell you the first two bacteria which causes genital ulcer, they show safety pin appearance. The first two bacteria, they show safety pin appearance. Safety pin appearance. The next two bacteria, they won't show safety pin appearance. They won't show safety pin appearance. So this is the fourth topic, genital ulcerative disease. Done. So these are the key points what I have given you people. Once again I am telling you, sir, sab padhne ke baad I have given you the solution, how to remember, how to answer in the exam. Pseudobuboes, Klebsiella granulomatis, painful, Haemophilus, painless, sir, syphilis, one is painful, one is painless, sir, Chlamydia trachomatis. Sir, with that we are done with the fourth topic. Sir, with that these four topics are mainly related to bacterial infections. These four topics are mainly related to bacterial infections. Sir, moving on to the viral infections. Sir, first topic is viral clinical presentation. Right? What is the clinical presentation of viruses? Sir, next topic is lab diagnosis of virus, and finally, sir, treatment of viruses. Okay, three topics we are covering all the important points of viruses. Okay, first clinical diagnosis, then lab diagnosis, then treatment. Sir, let's focus on clinical presentation. Sir, 4 viruses ka clinical presentation is very, very important in the entrance exam. Which are those 4 viruses? First, you have to remember those 4 viruses. Which are to remember those? Sir, herpes virus, HIV virus. Sir, first 2 viruses you keep easy to remember. HH, hepatitis, herpes and HIV. So next 2 viruses, parvo and human papilloma virus. human papillomavirus. So these are the 4 viruses whose clinical manifestations are very, very important for entrance exam. Which are the 4 viruses? Sir, herpes, or you can remember as, okay, HHV and HIV, right? Because you know herpes virus are known as HHV viruses, no, human herpes viruses, HHV and HIV, right? Then parvovirus and papilloma virus. So these are the 4 viruses whose clinical manifestations are very, very, very important for the INICET exam. INICET examiner's favorite. And if the question comes, usually the question comes from clinical manifestations. Usually the question comes from clinical HHV means human herpes virus. HIV means, you know, HIV virus, human immunodeficiency virus. Then parvovirus and papilloma virus. Let's start with herpes virus. You know, we have 8 herpes viruses, but 5 herpes viruses are very, very important, and those 5 herpes viruses are there in front of you. The first herpes virus is herpes simplex virus 1, the second is herpes simplex virus 2, the third is varicella zoster virus, and the fourth is Epstein-Barr virus, and the fifth is cytomegalovirus. I want to divide them. Sir, I want to divide them as 3 plus 2. I want to divide them as 3 plus 2. HSV1, HSV2 and VZV, then EBV and CMV. And what do they cause? Very, very important for entrance exam. Sir, herpes simplex virus 1 causes temporal lobe encephalitis. Encephalitis involving only temporal lobe. HSV2 causes genital herpes, and which will lead to genital ulcer, which will lead to neonatal herpes, which may lead to Mullard meningitis. And I always tell students, divide 2 plus 2. Because first 2 things they occur in the mother. Next 2 things they occur in the child. The mother will suffer from genital herpes and genital ulcer, a pregnant woman. And the baby got delivered from this mother who was suffering with genital herpes or genital ulcer. Baby will develop neonatal herpes, and baby may develop Mullard meningitis. So genital herpes, genital ulcer in the mother, neonatal herpes and Mullard meningitis in the child. And now VZV is varicella zoster virus, which is also known as chickenpox virus, causes chickenpox. And you know, on reactivation infection, it can cause shingles, which is also known as herpes zoster. And Epstein-Barr virus, sir, Epstein-Barr virus and cytomegalovirus, they cause infectious mononucleosis. Both of them, they cause infectious mononucleosis. But what is more important is, sir, Epstein-Barr virus causes carcinoma and cytomegalovirus causes post-transplant infection. Sir, which malignancy is caused by Epstein-Barr virus? Remember 2 plus 2. 2 carcinomas, 2 lymphomas. 2 carcinomas caused by Epstein-Barr virus, sir, gastric carcinoma and nasopharyngeal carcinoma. Gastric carcinoma and nasopharyngeal carcinoma. Sir, 2 lymphomas are Burkitt's lymphoma and Hodgkin's lymphoma. 2 lymphomas are, sir, Burkitt's lymphoma and Hodgkin's lymphoma. Easy to remember, 2 plus 2. Sir, 2 carcinomas, 2 lymphomas. Gastric carcinoma, nasopharyngeal carcinoma. Then Burkitt's lymphoma and Hodgkin's lymphoma. Very important. Which malignancy is caused by Epstein-Barr virus? And cytomegalovirus causes what? Post-transplant infection. But, and also you need to know what does it cause in post-transplant infection. The cytomegalovirus in post-transplant patient, it can cause meningitis, it can cause pneumonia, it can cause gastroenteritis, it can cause any disease, but it won't cause nephropathy. That is important. The post-transplant patient, any disease, you have to answer cytomegalovirus, but nephropathy, you have to answer BK virus. Remember, BK virus means borrowed kidney virus. Full form is important. Why? If you know the full form, easy to remember. BK virus means borrowed kidney virus. What does it do? It burrows the kidney and causes nephropathy in post-transplant patient. And nephropathy is caused by BK virus in post-transplant patient. Other than nephropathy, any other disease caused by cytomegalovirus. Very, very important. So this is about the clinical manifestations of herpes viruses. 5 herpes viruses. Okay, 5 herpes viruses. Guys, once again, very, very important. Let's discuss the herpes viruses. Sir, HSV1. Sir, HSV1 causes temporal lobe encephalitis. HSV2 causes, sir, 2 things in mother, 2 things in child. Sir, genital herpes and genital ulcer in the mother, neonatal herpes and Mullard meningitis in the child. Then, sir, VZV, varicella zoster virus causes what? Sir, varicella zoster virus causes chickenpox, and on reactivation it causes shingles, which is known as herpes zoster. Sir, Epstein-Barr virus and cytomegalovirus, they cause infectious mononucleosis, but malignancy is caused by Epstein-Barr virus. 2 carcinomas, sir, gastric carcinoma and nasopharyngeal carcinoma. 2 lymphomas, sir, Burkitt's lymphoma and Hodgkin's lymphoma. Sir, post-transplant infection, sir, any disease, cytomegalovirus except nephropathy. Nephropathy in post-transplant patient is caused by BK virus. With that, we are done with the 5 important clinical manifestation caused by 5 herpes viruses. Moving on to the second virus, HIV virus. You know, HIV virus causes a disease known as HIV disease. Sir, HIV virus causes a disease known as HIV disease. You know, HIV disease is a chronic disease. HIV disease is a chronic disease. So WHO classified this disease into 4 stages. WHO classified this disease into 4 stages. So in that, the 2 stages which are important. The 2 stages which are important are stage 3 and stage 4, and that's why those 2 stages are there in front of you. And remember, stage 4 is also known as AIDS defining illness. Right? Stage 4 is also known as AIDS defining illness. That means the end stage of the HIV is known as AIDS, and stage 4 is known as AIDS defining illness according to CDC. Okay, now we have 5 important manifestations in stage 3 and 5 important manifestations in stage 4. So for that, I always tell students, remember 2 plus 2 plus 1. Easy to remember. 2 plus 2 plus 1, easy to remember. Stage 3, sir, oral candidiasis and oral hairy leukoplakia. And remember, both of them, they manifest with white color membrane in the oral cavity. Both of them, they manifest with white color membrane in the oral cavity. When you rub this white color membrane is removed. On repeated rubbing, the white color membrane is removed. Oral candidiasis. On rubbing, the white color membrane is not removed. The white membrane is not removed. Oral hairy leukoplakia. Man, very important. This is what they ask. Right, sir, oral candidiasis and oral hairy leukoplakia. First of all, they occur in stage 3, and both these diseases manifest with white color membrane in the oral cavity. And oral candidiasis, you know, it is caused by candida. Oral candidiasis is caused by candida, and oral hairy leukoplakia is caused by Epstein-Barr virus. And both of them, they manifest with white color membrane in the oral cavity. On repeated rubbing, if that white membrane is removed, it is candidiasis, oral candidiasis. Not removed, it is oral hairy leukoplakia. Remember, the white membrane is adherent in Epstein-Barr virus to the oral cavity. It is not possible to remove even if you rub the white color membrane. That is what they ask. So oral candidiasis, oral hairy leukoplakia, so easy to remember. So the next two are fever more than 1 month, diarrhea more than 1 month. So easy to remember. And the last one is pulmonary tuberculosis. These are the 5 manifestations in stage 3 of HIV. Right? Sir, once you have got the confidence that I remember the 5 manifestations in HIV, oral candidiasis, oral hairy leukoplakia, fever more than 1 month, diarrhea more than 1 month, pulmonary TB, moving on to the stage 4. So stage 4 is also known as AIDS defining illness. The first 2 manifestations are esophageal candidiasis and wasting syndrome. देखो oral candidiasis stage 3 में आएगा, esophageal candidiasis stage 4 में आएगा, and wasting syndrome. Then sir, all opportunistic infections and all malignancies, stage 4. All other opportunistic infection and all malignancies, stage 4. Sir, extrapulmonary TB, sir, stage 4. So easy to remember, 2 plus 2 plus 1, right? And this is what they ask in the exam. And the most common cancer occur in HIV is Kaposi sarcoma. Sir, once again, what are the manifestations of HIV in stage 3 and stage 4? Sir, oral candidiasis, white membrane is removed. Oral hairy leukoplakia, white membrane is not able to remove or cannot be removed. Fever more than 1 month, diarrhea more than 1 month, and pulmonary TB. Sir, stage 4. Esophageal candidiasis and wasting syndrome. All other opportunistic infection on all malignancies like Kaposi sarcoma and extrapulmonary TB. देखो last वाला याद रख लो, pulmonary TB and extrapulmonary TB. Pulmonary TB stage 3, extrapulmonary TB stage 4. And remember, sir, pulmonary TB is the most common opportunistic infection in HIV. Sir, which is the most common opportunistic infection in HIV? Sir, pulmonary TB is the most common opportunistic infection in HIV. Okay, big fan, sir. Man, I am also a big fan of you people. Because you people have come here to attend the class. I am really a big fan of you people. आए हो तो कुछ फायदा लेके जाना है और अच्छे से पढ़ना है और अच्छे से राइट स्कोर करना है और अच्छी सीट निकालना है. ठीक है, चलो सर. मोस्ट कॉमन opportunistic is pulmonary TB. Sir, HIV is done. Sir, herpes is done, HHV is done, HIV is done. Moving on to the next two, sir, parvovirus and human papilloma virus. Sir, we'll focus on parvovirus. The parvovirus you have to remember with respect to the group of individuals, sir. Sir, what does it cause in children? What does it cause in adults? What does it cause in sickle cell anemia? What does it cause in immunocompromised patient? What does it cause in congenital infection? And I always tell students, remember 2 plus 2 plus 2. Always tell students, remember 2 plus 2 plus 2. Okay, easy to remember. Okay, 2 plus 2 plus 2, easy to remember. So first you remember what does it cause in children and adults. Then remember what does it cause in those patients who are suffering from sickle cell anemia, and what does it cause in those patients who are suffering from immunocompromised patient. Then you have to remember congenital infection. Parvovirus congenital infection, what is the manifestation? See, parvovirus means the first thing what students will tell is slapped cheek appearance. Slapped cheek appearance means it looks like somebody has slapped the baby. Why? Because you see rashes on the cheeks of the baby. Sir, because you see rashes on the cheeks of the baby, right? In the baby, parvovirus causes slab cheek appearance. Adults might involve joints causing manifesting with arthralgia. Sickle cell anemia may it causes aplastic crisis. To remember it easily, I always tell students, rather than aplastic crisis, remember as aplastic anemia. Right, rather than remembering aplastic crisis, remember. So sickle cell anemia patient में क्या करेगा? aplastic anemia करेगा, very easy. तो immunocompromised patient में क्या करेगा? pure red cell aplasia करेगा, pure red cell aplasia करेगा, simple, PRCA, right? So remember sickle cell anemia, aplastic anemia, immunocompromised patient pure, sir pure red cell aplasia मतलब क्या? loss of RBCs, बस इतना ही है, loss of RBCs, okay, loss of RBCs. Okay, loss of RBCs. And congenital infections are non-immune fetal heterops. Non-immune. Sir, congenital parvovirus infection, what do you see, sir? We see non-immune fetal heterops. Remember, immune fetal heterops is seen in RH incompatibility, which is also known as erythroblastosis fetalis, that you should not forget. Non-immune fetal heterops in parvovirus. Non-immune. Immune fetal heterops we see in RH incompatibility or erythroblastosis fetalis. सर ये हो गया सर, नो नीड ऑफ निमोनिक गाइस, ओके, ये इप्राका ये सब याद मत रखो यार, सिंपल यार, दो डिवाइड करो, याद रख लो, बहुत इजी होगा, जितना निमोनिक ज्यादा होगा. रिमेंबर, हर क्लास में, इन एवरी क्लास आई ऑलवेज टेल, टू मच ऑफ टू गुड बिकम्स टू बैड, टू मच ऑफ टू गुड बिकम्स टू बैड. I am not telling not to make mnemonics, but just imagine if you make too many mnemonics, it will become difficult to remember. ये sentence याद रखो, too much of too good becomes too bad. I am telling mnemonic is good, but too many mnemonics, it is bad. So you should not make mnemonics in every place. Okay, anyways, sir, children and adults, sickle cell anemia and immunocompromised congenital infection. Sir, congenital infection, non-immune fetal heterops, children में तो पता है slab cheek appearance, adults में तो arthralgia. बस बीच का दो याद रखना है, that also I told you, sickle cell anemia, aplastic anemia, immunocompromised patient, pure red cell aplasia हो गया. Sir, now human papilloma virus. Human papilloma virus. Right, human papilloma virus. Sir, human papilloma virus, sir, we have to remember only two diseases. Sir, human papilloma virus, you have to remember only two diseases: anogenital warts and cervical cancer. Anogenital warts and cervical cancer. Sir, anogenital warts caused by 6 and 11 serotype. Anogenital warts is caused by 6 and 11 serotype, and you already know that anogenital warts is also known as condyloma acuminata. आपको पहले से ही पता है, निम्गे ಮೊದಲೇ ಗೊತ್ತು, right? ಮೊದಲೇ ಗೊತ್ತಿದೆ, acuminata. Anogenital warts ನಾವು condyloma acuminata ಅಂತ ಕರಿತೀವಿ, ಅಲ್ವಾ? So that condyloma acuminata is nothing but anogenital warts caused by 6 and 11 serotype. That is not what is important. What is important for entrance exam, which I want to highlight, is cervical cancer. What they ask in the exam is cervical cancer. Sir, how many serotypes cause cervical cancer? The answer is all the serotypes, they cause cervical cancer. All the serotypes means the ones which are mentioned here. 6 and 11 they cause cervical cancer. 16 and 18 they cause cervical cancer. 31, 33, 52, 58 they cause cervical cancer. If you count them, there are 9 serotypes that cause cervical cancer. Sir, out of these 9 serotypes, which are having low risk causing cervical cancer, 6 and 11, which are the most common causing cervical cancer, 16 and 18, which are the other serotypes causing cervical cancer, sir, 31, 33, 45, 52, 58. Sir, I have given the headlines because that is what they ask in the exam. What they ask in the exam is which are the serotypes having low risk causing cervical cancer. Sir, 6 and 11, which are the most common serotypes causing cervical cancer. 16 and 18, which are the other serotypes causing cervical cancer. 31, 30. So other serotypes के लिए I just want to remove the star mark because other serotypes are not important. No need to remember. Okay, ನೆನ್ಪಿಡೋದು ಬೇಕಾಗಿಲ್ಲ. Other serotypes, no need to remember. Okay. Sir, low risk and most common, that is what they ask. All the 9 serotypes they cause cervical cancer. And which are the oncogenes which are responsible for cancer? That is also a very important question. Sir, E6 and E7 are the oncogenes, है ना? E6 oncogene inhibiting P53 and E7 oncogene inhibiting retinoblastoma gene, and both are tumor suppressor genes. Okay, forget about that. Sir, E6, E7, you remember this, E6, E7 genes. E6, E7 genes are the proto-oncogenes responsible for cancer. And how can you prevent cervical cancer? Sir, cervical cancer we can prevent by using a vaccine, which is a subunit vaccine, and the subunit present is L1 antigen, and the name of the vaccine is Gardasil 9. 9 means, right, name of the vaccine is Gardasil 9, and here 9 means all the 9 serotypes. Okay, sir, each and everything is a question. Which are the serotypes having low risk to cause cervical cancer? Which are the serotypes which are most common causing cervical cancer? Which are the proto-oncogenes causing cervical cancer? And sir, which is the subunit present in the subunit vaccine L1 antigen? What is the name of the vaccine? Gardasil 9, sir. Each and everything is a question. This is what they ask in the exam. So with that, guys, we have completed the what's fifth topic. Which is the fifth topic? Viruses clinical presentation. 4 viruses, and I have told you how to remember HHV and HIV, parvo and papilloma. देखो बहुत easy है अल्वा വളരെ എളുപ്പമാണ് right sir. HHV and HIV, human herpes virus and human immunodefense, parvo and papilloma. So HHV, HIV, parvo, papilloma, sir, herpes virus, 5 herpes viruses and their manifestation. HIV, 5 manifestations, 5 manifestations in stage 3 and 5 manifestations in stage 4. Sir, parvo virus 2 + 2 + 1. Children and adults में क्या करेगा? Sickle cell anemia and immunocompromised patients में, right? इधे इंद चेयुम and congenital infection में इधे ಏನ್ ಮಾಡುತ್ತೆ? Sir, human papilloma virus, sir, cervical cancer. Which are the serotypes? Which are the genes? Which is the vaccine and which is the subunit? And this is what they ask. This is what they ask, right? This is what they ask. So with that, all the important viruses ka clinical manifestations we are done with the fifth topic. Moving to the next topic, sir. Abhi now we have done the clinical manifestations, clinical presentation of the viruses. Now lab diagnose the viral infection. Man, here I am giving you a NKP. Here I am giving you a NKP. Sir, abhi now you will ask, sir, what do you mean by this NKP? Right? NKP means Dr. Naseer's key points. These are my key points. Okay, sir, NKPs, right? NKPs, like, you know, if you have attended my class, you would have got blueprints. Apart from blueprints, what you don't know, people, what I have not showed you, people, are NKPs. Here onwards, I'm going to show my NKPs. So Naseer's key points. NKPs means Naseer's key points. See, why I have given the name NKP, Naseer's key points, means because this is not exactly how it is. This is not exactly how it is. This is how I am giving you. This is how I am giving you. With this, you can answer in the exam. With this, you can answer in the exam. That's why I call them as Naseer's key points. Because the key points what I'm giving you is the modifications or the techniques given by me, which is not suitable for all organisms, but it can make your answer right in the exam. But it can make your answer right in the exam. Okay, what is the NKP? So now we have to see the NKP is for lab diagnosis of viral infection. So once you get a question on the lab diagnosis of viral infection, first thing what you see in the exam is whether examiner has mentioned the duration or not. Mention the duration or not. So duration from where? So duration from symptoms. That is also important. Duration from symptoms. Duration from symptoms mentioned or not. That is the first important thing what you have to see in the exam when you get the question from the lab diagnosis of viruses. Just now, first we consider the first part. What is the first part? Sir, lab diagnosis of viral infection question has come and the duration has not mentioned. Duration has not mentioned. Without duration. Then the NKP is, remember this NKP, guys. Then the NKP, Naseer's key points. Then the NKP is HIC, HPR and others. What is the NKP for lab diagnosis of viral infections without duration? HIC, HPR and others. HIC, HPR and others. Sir, what do you mean by this NKP, HIC, HPR and others? So see here, HIC means, sir, HIC means H for herpes. H for herpes, I for influenza, C for corona. 3 viruses. HIC means 3 viruses. Herpes, influenza and corona. HIC. And HPR. HPR means, sir, H for hepatitis B. H for hepatitis B. P for polio and rota. Polio and rota. R for rabies. So from R we get to rota and rabies. But rota and rabies you should not put together. Along with the polio you have to put rota. Why I will tell you. But what is HIC? What is HPR? You should be knowing it. HIC means herpes, influenza, corona. Now everybody has to tell what is HIC? Herpes, influenza, corona. Herpes, influenza, corona. What is HPR? Hepatitis B, polio and rota and rabies. Sir, what I'm trying to tell is HIC may have given you 3 viruses, herpes, influenza and corona. HPR may have given you 4 viruses, hepatitis B, polio and rota and rabies. Sir, I have just separated 7 viruses. 7 viruses. And what I'm trying in this NKP is, when you get these 3 viruses, HIC, sir, when you get these 3 viruses, HIC, you have to answer PCR. You have to answer PCR. When you get these 3 viruses, HPR, you have to answer antigen detection. Other than these 7 viruses, any viruses come in the exam, you have to answer antibody detection, right? Then what happens? You will be right in the exam. You will be right. This is not actually how it is. There are many more viruses where we have to do PCR. There are many more viruses where we do antigen detection. Okay, but I have just approximated with the by taking few important viruses. And if you remember this, which is easy to remember, sir, most of your questions will be right in the exam. Right, sir, what is the NKP for lab diagnosis of viral infections without duration? Then you have to say HIC, HPR and others. HIC is their answer PCR, HPR is their answer antigen detection, others are their answer antibody detection. So this you have to follow when there is no duration mentioned. Sir, what is the NKP for the lab diagnosis of viral infection when duration is mentioned? And duration from where? Duration from symptoms. That is important. Duration from where? Sir, this is a very important point. Sir, duration from where? Duration from symptoms. Sir, isko bhulna nahi chahiye. Duration from symptoms. Sir, duration from symptoms is, sir, duration from symptoms is less than or equal to 7 days or more than or equal to 7 days. Cutoff point is 7 days. Cutoff point is 7 days. Sir, less than or equal to 7 days, then you have to answer PCR. If PCR is not there, you have to answer antigen. I have written the greater than symbol that you should not forget. PCR is better than antigen detection. So less than 7 days from symptoms. Less than 7 days from symptoms, answer should be PCR. If PCR is not there in the options, you have to answer antigen. You have to answer antigen. You have to answer antigen. If more than 7 days is mentioned, more than 7 days is mentioned, all the viruses, you have to answer antibody detection. All the viruses you have to answer antibody detection. All the viruses you have to answer antibody detection. Right? Antibody detection. Sir, what about dengue virus? That is the question what you are asking. And just apply the NKP. HIC, HPR and others. Where it comes? It comes in the others. So when duration is not mentioned, okay, you have taken an example dengue virus and I'm applying my NKP. So dengue virus, now in the question you have to say duration is mentioned or not. We'll take both the things. First, sir, duration is not mentioned. Question is lab diagnosis of dengue virus. Then you have to say dengue virus come under HIC and HPR. No, where it comes others. So answer is antibody by ELISA. Sir, duration is mentioned. Sir, how to diagnose dengue virus infection? Duration is mentioned. And duration is less than 7 days. You have to answer PCR. Sir, PCR was not there. Then you have to answer antigen. Which antigen? NS1 antigen. Sir, duration is mentioned more than 7 days. Then you have to answer antibody. Any doubts? They go so simple, man. So simple. You have taken an example of dengue virus that I have explained with respect to dengue virus. So duration is not mentioned. Then you have to follow the NKP, HIC, HPR and others. And dengue virus come under others. Then duration is not mentioned. Your answer should be antibody by ELISA. Duration is mentioned. Then you have to say less than 7 days or more than 7 days. So less than 7 days, PCR should be the answer. But PCR was not there. NS1 antigen should be the answer. Sir, more duration was mentioned, more than 7 days from symptoms, antibody should be the answer. You apply and see this NKP, all of your answers will be right. Once again, I'm telling you, sir, NKP is not 100, NKP will not fit 100% for all viruses. NKP will not fit 100% for all viruses. Don't go for each and every virus, then it is not going to make sense. That's why it is NKP, man. This is my key points. But if you remember this, your answers will be right in the exam. Your answers will be right in the exam. I can say more than 95% of the times your answers will be right in the exam based on the lab diagnosis. If you remember for each and every virus, what is the lab diagnosis? Chances of making it right and remembering is 20%. If you remember the NKP, more than 95% you can make it right. And that's why we have NKPs. NKPs will simplify things. Sir, NKP without duration, HIC, HPR and others. NKP with duration, symptoms within 7 days, PCR and antigen, symptoms more than 7 days, antibody. Simple hai na? No confusion. Okay, no confusion. Sir, clinical manifestation is over, lab diagnosis is over, moving on to the treatment. Okay, sir, before we move on to the treatment, sir, in the lab diagnosis, we have to highlight the lab diagnosis of hepatitis B virus. We have to highlight the lab diagnosis of hepatitis B virus. So before I proceed, I want you to tell how will you diagnose hepatitis B virus? How will you diagnose hepatitis B virus? Duration is not mentioned. Right? I am waiting for the answer in the chat box. How will you diagnose hepatitis B virus without duration? Duration is not mentioned. Duration is not mentioned. Duration is not mentioned. How will you diagnose hepatitis B virus? then you just have to apply the NKP. What is the NKP? Without duration, HIC, HPR and others. What is HIC? Herpes, influenza and corona. So HIC mate is not there. What is HPR? Hepatitis B. HPR means hepatitis B. It comes under HPR. Therefore, answer is antigen detection. Answer is antigen detection. When duration is not mentioned. When duration is not mentioned. Antigen detection. Very good. Very good. Sir, which antigen we detect? Sir, HBsAg antigen we detect. And that is what we have detected. Now we have detected. So there are two possibilities. HBsAg is positive, HBsAg is negative. Two possibilities. HBsAg is positive, HBsAg is negative. So HBsAg is positive means there are two possibilities. Infection is there or carrier state. Antigen is there. So remember, antigen is there, two possibility. Infection is there or carrier state. Sir, antigen is there. So first I have to narrow down to either infection or carrier state. Only two possibilities. Infection and carrier state. Remember, HBsAg, see in the question first you have to look for HBsAg antigen. Sir, HBsAg antigen positive to narrow down to infection and carrier state. Now how can I say infection or carrier state? For that you have to look for symptoms. For that you have to look for what? Sir, you have to look for symptoms. Symptoms. Sir, symptoms are there. Right? Symptoms are there. Infection symptoms are not there. Carrier state. Symptoms are there. Infection symptoms are not there. Carrier state. With that, carrier state is done. Sir, when symptoms are there, you have proved it is infection. You have proved it is infection. Sir, now you have to look for two things. The two things for what you have to look for is, sir, one is HBeAg and anti-HBc. Sir, HBeAg is positive. HBeAg is positive. Then you have to say infection is there with high infectivity. HBeAg is negative. Then you have to say infection is there with low infectivity. Because HBeAg is a marker of infectivity. If it is there, high infectivity. If it is not there, low infectivity. Then you have to look for anti-HBc. Anti-HBc, IgM is there. Acute infection, IgG is there. Chronic infection. So this is about infection. So with that we have completed one side when you get HBsAg positive. Sir, HBsAg positive, either infection or carrier state. How will you say infection or carrier state? Symptoms is there, infection, symptom is not there, carrier state. When symptoms are there, when you have proved the infection, you have to prove the infection is having high infectivity or low infectivity, acute or chronic. To say high infectivity or low infectivity, I will look for HBeAg. To say it is acute or chronic, I will look for anti-HBc. Then I will decide infectivity and chronicity. So done with the first part. Sir, I saw the question in the question HBsAg is negative. HBsAg antigen is negative. HBsAg antigen is negative. Sir, antigen is negative means rule out infection and carrier state. First thing you have to rule out infection and carrier state. Because to prove infection and carrier state is there, you have to prove antigen is there. When HBsAg antigen is not there, rule out infection and carrier state, then what are the possibilities? Sir, if HBs antigen is negative, the possibilities are early recovery, complete recovery and vaccination. Three possibilities. Early recovery, complete recovery and vaccination. And you have to remember early recovery is also known as window period. You have to remember early recovery is also known as window period. So to say early recovery or window period, you have to look for the antibodies anti-HBc and anti-HBe. Anti-HBc, anti-HBe, these two antibodies are there. Other things are negative. Early recovery, window period. All the three antibodies are there. Complete recovery. Only one antibody is there, anti-HBs, to vaccination. So this is the summary of complete or expanded lab diagnosis of hepatitis B virus infection based on the antigen HBsAg antigen. So when HBsAg antigen is there, which are the two possibilities? When HBs antigen is not there, which are the three possibilities? And then how will you diagnose? Right? I have tried to simplify this because it is very difficult, and this is INICET people ka very favorite question. Very favorite. So with that we have completed the extended version of lab diagnosis. Right? Extended version mein we have discussed lab diagnosis of hepatitis B virus. Right? So once you have completed the lab diagnosis, moving on to the treatment. So remember, only 4 viruses have treatment. Remember, only 4 viruses have treatment. Only 4 viruses have treatment. And those 4 viruses are there in front of you. So which are the 4 viruses? Hepatitis virus, herpes virus, HIV virus, influenza virus. You know we have 5 hepatitis viruses, A, B, C, D, E. Out of 5 hepatitis virus, only hepatitis B and hepatitis C have treatment. Sir, what is the treatment for hepatitis B? Sir, tenofovir. Hepatitis C, sofosbuvir and velpatasvir. Herpes, acyclovir. HIV, you know LDT. LDT means lamivudine, dolutegravir and tenofovir. Influenza virus, oseltamivir. Sir, only 4 viruses have treatment. Only 4 viruses have treatment. Remember, other viruses we don't have treatment. Other viruses we don't have treatment. In the treatment for hepatitis viruses, very important, I prefer to put a star mark for hepatitis viruses treatment. Remember, hepatitis B, tenofovir, hepatitis C, sofosbuvir and velpatasvir. And remember, hepatitis B treated with only 1 drug, hepatitis C treated with 2 drugs. Herpes to sabko pata hota hai, acyclovir. Influenza virus also oseltamivir. HIV also, you know, LDT, that is lamivudine, dolutegravir and tenofovir. That's why where you have to focus more is hepatitis. With that, we are done with the treatment of viruses. With that, 7 topics are over. So initially 4 topics related to bacteria and next 3 topics related to viral infectious diseases. Now moving on to the fungal infectious diseases. So 2 topics we discuss in fungal infectious diseases: miscellaneous fungal infection and dimorphic fungal infections. 2 topics. Sir, miscellaneous fungal infections. Sir, miscellaneous fungal infections, I want to discuss 2 organisms: Pneumocystis jirovecii. The Pneumocystis jirovecii, which is also known as Pneumocystis carinii. Pneumocystis jirovecii, which is also known as Pneumocystis carinii. Sir, one more is Rhinosporidium seaberi. Sir, I want to put star marks. Sir, both are examiners very favorite. Both are examiners very favorite. And you also need to know that the Pneumocystis jirovecii, earlier it was considered as protozoa, but now it is considered as fungus. Rhinosporidium seaberi is exactly opposite. Earlier it was considered as fungus, but now it is known as protozoa. It is known as aquatic protozoa. Now it is known as protozoa. It is known as aquatic protozoa. Right? Exactly opposite. Sir, ultimately where you have to focus is now what are they? Now what are they? So now Pneumocystis jirovecii is a fungus, whereas Rhinosporidium seaberi is aquatic protozoa. It is aquatic protozoa. Now what do they cause? Sir, what do they cause? If you ask me the question, the answer is very simple. The Pneumocystis jirovecii causes pneumonia, which manifests with dyspnea, and Rhinosporidium seaberi causes rhinosporidiosis, which manifests with nasal polyps. Which manifest with nasal polyps. Nasal polyps. Right? And Pneumocystis jirovecii, it is present as Pneumocystis jirovecii. Sir, it is present as crust black color cyst. This is what you see here. Black color cysts which are crust. To some person they look like ping pong balls which are crust. So that person called as crust ping pong ball appearance. And you have to remember the name of this stain also. That is also important. So the name of this stain is GMS stain. GMS stain. Gomori methanamine silver stain. Sir, in Gomori methanamine silver stain, if you see crust black color cyst, which gives crust ping pong ball appearance, Pneumocystis jirovecii. In PAS stain, what is this? PAS stain. PAS means periodic acid skiff. Periodic acid skiff. What are you seeing here? Sir, if I see, right, sporangium, if I see a sporangium containing endospores, sporangium containing endospores, somebody called it as spirule. The sporangium containing endospores. So this, what you see here, so this is the sporangium. And what you see inside, these are endospores. This entire structure is known as spirule. So this spirule is also, we see also in another fungus which is known as coccidioides. If you have studied yeast form of coccidioides, yeast cell with endospores inside, known as spirules. The spirule what you see in coccidioides is also seen in rhinosporidiosis. Rhinosporidiosis is also present in the form of spirule, which is nothing but sporangium containing endospores. And that is PAS stain. And finally, the treatment for both of them. So treatment is also important. So the treatment for Pneumocystis jirovecii pneumonia is cotrimoxazole. And the treatment for Rhinosporidium seaberi is dapsone. If you see, both are antibacterial drugs. So these are the 2 important miscellaneous fungal infections which are very important for INICET exam: Pneumocystis jirovecii and Rhinosporidium seaberi. Remember, pneumocystis cerevisiae causes pneumonia, rhinosporidosis causes rhinosporidosis manifest with polyps in the nose. And how to identify? Crust black color cyst giving ping pong ball appearance in GMS staining, pneumocystis. Sporangium containing endospores known as sperules in pus stain. And treatment for pneumocystis cerevisiae is cotrimoxazole. And for rhinosporidosis is Dapsone. Very simple, very, very important. So once we are done with the miscellaneous fungal infection, moving on to the dimorphic fungal infections. Sir, we have many dimorphic fungi, but here we are discussing two important dimorphic fungi. The two important dimorphic fungi what we discuss here are, one is histoplasma, one more is Talaromyces marnefi. One is histoplasma, one more is Talaromyces marnefi. And both of them, what do they cause? Sir, both of them they cause pneumonia. Both of them they cause pneumonia. So one is histoplasma, one more is Talaromyces marnefi. Both of them they cause pneumonia. And very important, Talaromyces marnefi produces red color pigment on SDA. I want to highlight with a star mark. Talaromyces marnefi produces red pigment on SDA. Very, 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 very important. So these are the two important dimorphic fungi. One is histoplasma, one more is Talaromyces marnefi. And both of them they cause pneumonia. And pneumonia caused by histoplasma is known as histoplasmosis, which is also known as Darling's disease, which is also known as Ohio Valley fever. So histoplasmosis is known as histoplasmosis because it is caused by the fungus histoplasma. It is known as Darling's disease because it was first described by Dr. Darling. That is the name of the person, Dr. Darling. Ohio Valley fever because it is most commonly seen in the Ohio Valley. That's why it is known as Ohio Valley fever. So similarly, pneumonia caused by Talaromyces is known as Talaromycosis, which is also known as penicilliosis because earlier Talaromyces marnefi was known as Penicillium marnefi. That's why Talaromycosis is also known as penicilliosis, and it is most commonly seen in Southeast Asia. Sir, once you know the organism, dimorphic fungus, the disease name, and the disease is pneumonia, now identify. Sir, what do you mean by dimorphic fungi? Dimorphic fungi are present in the yeast form and they are also present in the mold form. Sir, they are present in this is the yeast form and this is the mold form. This is the yeast form and this is the mold form. This is the mold form. The yeast form identification point is intracellular yeast. If the yeast cells are present within the cells, which is this cell you see here, macrophage. So this is the macrophage. This is the nucleus of the macrophage. Within the macrophage, what do you see? These are yeast cells. What are these? Yeast cells. Intracellular yeast histoplasma. So if you see yeast cells within the macrophage, you have to say it is histoplasma because we have only one intracellular yeast. That is histoplasma. And in the mold form, what do you see? Sir, tuberculate conidia means, sir, these are conidia and surrounded by these are tubercles. Sir, conidia surrounded by tubercles, sir, tuberculate conidia. That is the key identification point in the mold form, and that's how we diagnose histoplasma. In the yeast form, intracellular yeast. In the mold form, tuberculate conidia. Man confirmed it is histoplasma. If you talk about Talaromyces marnefi, sir, Talaromyces marnefi in the yeast form. Sir, they are oval-shaped yeast cells. With a septum inside. If you see oval-shaped yeast cell with a septum inside, those yeast cells are Talaromyces marnefi. Sir, oval-shaped yeast with septum inside. If you see, right, mold form, if it look like bottle brush means brush used to clean the bottle brush appearance. So if you see bottle brush appearance looking like a brush that is used to clean the bottle, Talaromyces ka mold form. And if you want, I can explain here. So this is hyphae. These are conidiophore, and these are pheolites, and these are conidia. Sir, hyphae, conidiophore, pheolites, and conidia. It gives a picture bottle brush appearance. So that is Talaromyces marnefi. So this is all about dimorphic fungal infections. Two important dimorphic fungal infections. Two important dimorphic fungal, histoplasma and Talaromyces. Don't forget red pigment produced by Talaromyces. And both of them they cause pneumonia. Both of them they cause pneumonia. And remember the yeast form and mold form. Histoplasma ka yeast form, intracellular yeast, mold form, tuberculate conidia. Talaromyces yeast form, oval shape yeast cells with septum, mold form, bottle brush appearance. So with that we are done with the two important dimorphic fungal infections and two important miscellaneous fungal infections. With that we have completed four important fungi, 2 plus 2. And with that we have completed 9 topics. So moving on to the last, sir, parasitology. Sir, initial 4 topics from bacterial infections, next 3 topics from viral infection, next 2 topics from fungal infections, and the last 3 topics now from parasitic infection. So beginning with the 10th topic, acid fast protozoa. When examiners very favorite. Acid fast protozoa. I want to highlight we have three acid fast protozoa: Cryptosporidium, Cyclospora, Cystoisospora. We have 3 acid fast protozoa: Cryptosporidium, Cyclospora, Cystoisospora, and all of them they cause diarrhea. All of them they cause diarrhea. All of them they cause gastroenteritis. All of them they cause diarrhea. Then how will you identify? Sir, we identify by seeing the acid fast oocyst. Right? We identify seeing what? Acid fast oocyst. I just prefer to write down that word, acid fast oocyst. Sir, we identify them by seeing the acid fast oocyst. I am seeing the acid fast oocyst. What is acid fast? No, pink color cyst in a blue color background. Pink color cyst in a blue color background. Acid fast cyst. Sir, when all the three of them they have acid fast oocyst, how will you identify? Shape and size of the cyst. Shape and size of the cyst. Sir, because all of them are acid fast, all of them are pink in color. But how will you differentiate? Shape and size of the cyst. Sir, if the cyst is round in shape and 4 to 5 micron in size, round in shape, 4 to 5 micron in size, that is small in size. Cryptosporidium, round in shape, 8 to 10 micron in size. 8 to 10 micron means double the size of Cryptosporidium. Then Cyclospora. Then Cyclospora, you can see here, see small size, you see big size. The small size, 4 to 5 micron. Cryptosporidium, bigger in size, double the size. Cyclospora, sir, oval in shape, Isospora. Isospora. Sir, first thing you have to fix in your mind that first two, Cryptosporidium and Cyclospora, are round in shape. Cryptosporidium and Cyclospora are round in shape, and Cystoisospora is oval in shape. When you know Cystospora is oval in shape, Cystoisospora identified. Oval shape, Cystoisospora, size, there is no need to know the size. Shape is enough. There is only one oval shape acid fast Cystoisospora. But there are two round shaped cysts. When there are two round shaped cysts, how will you differentiate? For them now there comes size, 4 to 5 micron, 8 to 10 micron. Right? So I will highlight the key points. Sir, oval shaped cyst. Oval shape acid fast Cystoisospora. Sir, round shape 4 to 5 micron, Cryptosporidium, round shape 8 to 10 micron. Sir, Cryptosporidium, round shape 8 to 10 micron. Sir, Cyclospora. And drug of choice is also important. Sir, drug of choice for Cryptosporidium is nitazoxanide, whereas nitazoxanide, whereas for Cyclospora and Cystoisospora it is cotrimoxazole. It is cotrimoxazole. So with that we have completed acid fast protozoa. Sir, everything is important. What do they cause? Sir, remember they cause diarrhea. All of them they cause diarrhea. All of them are acid fast. Then how will you differentiate? Sir, size and shape of the acid fast is, that is what is important. Oval shape. Sir, done, sir. Cystoisospora. Round shape. Cryptosporidium, Cyclospora. Cryptosporidium small in size 4 to 5 micron. Cyclospora bigger in size 8 to 10 micron. And remember Cryptosporidium nitazoxanide. I want to put a star mark, sir. Very important. Cryptosporidium treatment, nitazoxanide. Sir, remaining to cotrimoxazole. Sir, acid fast protozoa done. Very simple, easy. Sir, moving on to the next topic, the 11th topic. Sir, blood and tissue protozoa. Right, we have 5 blood and tissue protozoa, but important are 3. Sir, which are the 3 important blood and tissue protozoa? Sir, Leishmania, Plasmodium, and Toxoplasma. Very important. Leishmania, Plasmodium, and Toxoplasma. Plasmodium, we have 2 important species, Vivax and Falciparum. Vivax and falciparum, right? You know, leishmania we acquire by sandfly, which is known as phlebotomus, and plasmodium we get it by the bite of the Anopheles mosquito, and toxoplasma we get it from the cat, but not from the bite of the cat. Sir, we get it from the cat via feco-oral route, and the infective form is sporulated oocyst. That is also important, very very important. I want to highlight what is the infective form of toxoplasma. Sporulated oocyst, that means sporozoid containing oocyst, sporozoid coming from the cat entering via feco-oral route. Okay, so sporulated oocyst means sporozoid containing oocyst coming from the cat entering via feco-oral route. So we get infected from toxoplasma by sporulated oocyst. Okay, now, so leishmania causes leishmaniasis. Leishmania causes leishmaniasis, which is also known as Kala Azar, which is most commonly seen in Bihar. Manifest with hepatosplenomegaly. Okay, manifest with hepatosplenomegaly. Sir, Plasmodium causes a disease which is known as malaria, again manifest with hepatosplenomegaly. Sir, Toxoplasma causes a disease, toxoplasmosis, again manifest with cervical lymphadenopathy, that is enlargement of the lymph nodes in the neck. Sir, we know the three blood and tissue protozoa, leishmania, plasmodium and toxoplasma. You know the vector, sandfly, Anopheles mosquito and cat via feco-oral route. You know the disease name, you know the manifestation. Now lab diagnosis. So lab diagnosis, leishmania is identified by seeing the amastigote form. Leishmania is identified by seeing what? Amastigote form. This amastigote form is also known as LD body. If you want to know, you can write down that this amastigote form is also known as LD body. What is amastigote form? Sir, amastigote form means leishmania with a kinetoplast within the macrophage. Leishmania with a kinetoplast within the macrophage is amastigote form. So see, what do you see in this picture is macrophage. What do you see in this picture is macrophage. This is macrophage. This is nucleus of macrophage. And within the macrophage, what do you see? This round shaped structure is amastigote form. With that, you can see one more small round shaped structure, and this is kinetoplast. This is kinetoplast. So this is amastigote form, and that is kinetoplast. See here again, this is amastigote form, this is kinetoplast, this is amastigote form, this is kinetoplast. Sir, leishmania, first point, leishmania is intracellular, present within the macrophage. Leishmania is round in shape, which is known as amastigote form or LD body, and leishmania is having a special structure that is known as kinetoplast. Leishmania is having a special structure that is known as kinetoplast, and leishmania is having an antigen RK39 antigen. Very very important. So this is how you identify leishmania, right? And if you talk about malaria, plasmodium, sir, plasmodium we have to see Vivax and falciparum. Sir, Vivax we identify by seeing schizont or gametocyte, and falciparum is also identified by seeing the gametocyte. Sir, Vivax में schizont and gametocyte they look same, and this is how they look like. Round blue color structure with blue color dots. Sir, if you see round blue color structure with blue color dots, you have to identify schizont or gametocyte, because schizont and gametocyte they look same. And if you see this schizont or gametocyte round shape structure, it is Vivax. It is Vivax. And remember, Vivax is having PLDH antigen. Vivax is having, sir, PLDH antigen. Very very important. I prefer to put a star mark. Vivax is having PLDH antigen. And schizont and gametocyte, this is how the schizont and gametocyte look like. Whereas falciparum, sir, falciparum, if you talk about falciparum, sir, falciparum is having PLDH antigen and HRP2 antigen, two antigens. The PLDH antigen is Plasmodium LDH antigen present with Vivax and also with falciparum. But what is more important here is the HRP2 antigen. Highlight the HRP2 antigen. The HRP2 antigen present only with falciparum. PLDH antigen is present with both. Again, schizons are seen only with falciparum, and schizons are seen only with vivax, and schizon looks similar to gametocyte. But in falciparum, schizons are not seen. In falciparum, we see only gametocyte. We see only gametocyte. And if you see the gametocyte, sir, gametocyte is banana shape. Gametocyte is banana shape. So that is what is important here. Sir, round shape gametocyte and banana shape gametocyte. Right, sir, that is what is important. Round shape gametocyte and banana shape gametocyte. Sir, if you see round shape gametocyte vivax, banana shape gametocyte falciparum, and if you see only PLDH antigen vivax, if you see PLDH antigen HRP2 antigen falciparum. And finally, sir, if you see tachyzoids, sir, what are tachyzoids? Sir, if you see spindle shaped structures like this, if you see spindle shaped structures like this, these are tachyzoids. Tachyzoids. Sir, if you see tachyzoids, that is toxoplasm. Toxoplasm. It is not having any important antigen. So this is how we identify Leishmania, Plasmodium, and Toxoplasm. Finally, treatment is also important. That's why we have discussed the treatment too here. The treatment for Leishmaniasis: IV drug of choice liposomal amphotericin B, oral drug of choice miltefosine. Plasmodium vivax chloroquine and primaquine. Plasmodium falciparum artesunate, pyrimidamine. Okay, artesunate, pyrimidamine plus the artesunate pyrimidamine plus sulfadiazine, sulfadoxin. Sir, artesunate pyrimidamine plus sulfadoxin, that is the treatment for falciparum. And sir, pyrimidamine plus sulfadiazine, that is the treatment for toxoplasmosis. And you know, in case of pregnant condition, sir, the drug of choice is pyramycin. Because you know, pyrimidamine and sulfadiazine both are contraindicated in pregnancy. If you know the basics of what is that? Pharmacology. Why pyrimidamine is contraindicated? Anybody? Right, we are about to finish our class in 5 minutes. Sir, why pyrimidamine is contraindicated? Sir, it is a folate antagonist. It inhibits the folic acid synthesis. When folic acid synthesis is inhibited, what will happen? Neural tube defects, bone marrow suppression. And that's why pyrimidamine is contraindicated in pregnancy. Sulfadoxin, diazine. Sir, all sulfa drugs are contraindicated. Why? Sir, sulfa drugs are contraindicated because sulfa drugs causes hemolysis in pregnancy and also in G6PD deficiency. Right? Sir, when both the drugs are contraindicated in pregnancy, then how will you treat toxoplasmosis in pregnancy? Answer is pyramycin. Sir, with that, this is all about. Three important blood and tissue protozoa: Leishmania, Plasmodium, and Toxoplasma. Very, very important. Right? एक बार बोल दो यार, Leishmania, which is the vector? Sandfly. What does it cause? Leishmaniasis, also known as Kala-Azar. Most commonly seen in Bihar. How will you identify? A mastigote form, which is known as LD body, consists of kinetoplast and RK39 antigen within macrophage. Drug of choice: IV liposomal amphotericin B, oral miltefosine. Plasmodium. Sir, Plasmodium vector is Anopheles mosquito. Disease is malaria, manifest with hepatosplenomegaly. Plasmodium vivax, round shaped gametocyte with PLDH antigen. Plasmodium, and treatment is chloroquine plus primaquine. And Plasmodium falciparum, banana shaped gametocyte with PLDH antigen and HRP2 antigen. Treatment is artesunate pyrimidamine plus sulfadoxin. And sir, Toxoplasma causes toxoplasmosis acquired from cat via fecal-oral route, and infective form is sporulated oocyst, that is sporozoid containing oocyst. Causes toxoplasmosis, manifest with cervical lymphadenopathy, diagnosed by tachyzoids, and treatment is pyrimidamine plus sulfadiazine. In pregnancy, we have to use pyramycin. So these are the three important blood and tissue protozoa. When I'm going to tell you, I am telling you people that, man, very, very, very important. Very, very important. So the last topic, 12th topic. Opportunistic helminthic infection. right? We have only one opportunistic helminth. Remember this point, very, very important. We have only one opportunistic helminth, and the only one opportunistic helminth is Strongyloides turcoralis. Only one opportunistic helminth is Strongyloides turcoralis. It is known as parthenogenic worm. Why it is known as parthenogenic worm? Because it shows parthenogenesis. What is parthenogenesis? Right? Giving birth to new life without fertilization. Usually the new life will come after fertilization. That is the rule of nature. But there is always exception. There is always exception. There is nothing 100% in this universe. The new life can come without fertilization also. Female can give birth to new life without fertilizing with males, and this process is known as parthenogenesis. And Strongyloides worm show parthenogenesis. It can give birth to new life, right? It can give birth to the baby without fertilizing with males. Therefore, it shows parthenogenesis. That's why it is known as parthenogenic worm. Sir, what does it cause? Right? So, Strongyloides is an intestinal nematode. Strongyloides is an intestinal nematode. Intestinal nematode. Sir, it is an intestinal nematode which is ovoviviparous. You should not forget this. It is an intestinal nematode which is ovoviviparous. Because it is intestinal, it causes gastroenteritis. And it also causes cutaneous larva migrans. And it can also cause Loeffler's pulmonary eosinophilia. Sir, it can cause gastroenteritis, right? It can cause gastroenteritis. And it can also cause cutaneous larva migrans. And it can also cause LP, means Loeffler's pulmonary eosinophilia. Sir, what do you mean by ovoviviparous? Sir, ovoviviparous are the helminths which can be diagnosed by seeing larva in the stool sample. Ovoviviparous. What do you mean by ovoviviparous? Ovoviviparous are the helminths which can be diagnosed by seeing larva in stool sample. Sir, how many ovoviviparous helminths we have? Sir, we have only one ovoviviparous helminth, that is Strongyloides. Sir, what do you mean by we have only one ovoviviparous helminth? That means larva in stool sample is seen with only one helminth, that is Strongyloides. Sir, when you see this picture, what is this you are seeing? Sir, this is larva. And what is this sample? Stool sample. No need to identify which larva. Sir, there is only one larva present in stool sample. There is only one possibility, Strongyloides, because only one helminth larva will come into stool sample, Strongyloides. That's why only Strongyloides is ovoviviparous. Sir, ovoviviparous means larva in stool sample, and we have only one ovoviviparous helminth, Strongyloides. Therefore, once you see this picture, larva in stool sample, no need to think which is this larva, and no need of specific points to identify the larva. So larva in stool sample, if that is mentioned, so larva in stool sample, that is enough. This picture is enough to say this is ovoviviparous, because I'm seeing larva in stool sample. There is only one ovoviviparous, that is Strongyloides. And you know the drug of choice for Strongyloides is ivermectin. And very important, examiner's favorite, Strongyloides nematode. Sir, remember, it is an intestinal nematode which is ovoviviparous, and the treatment is ivermectin. I want you to remember these three sentences. Sir, it is an intestinal nematode, therefore it causes gastroenteritis with larva migrans and Loeffler's eosinophilia. It is ovoviviparous, that's why we diagnose by seeing larva in the stool sample, and the drug of choice is ivermectin. Sir, with that we have completed the 12th topic. Sir, with that we have completed today's session, all the important topics. I told you people that, sir, there are only 12 topics, but don't consider these are only 12 topics, because I told you initially, sir, in the bacterial and toxins we have seen 9 toxins and 9 bacteria. So then in the vectors we have seen 12 bacteria, 12 toxins, 12 plus 9. Sir, 12 plus 9, 21. 12 plus 9, 21. Sir, in meningitis we have seen 7 organisms. In meningitis we have seen 7 organisms. 7 organisms. Sorry, 3 causing acute bacterial meningitis, 3 causing neonatal meningitis, 1 causing chronic bacterial meningitis. 7, 21 plus 7, 28. 28. Sir, in genital ulcerative disease, 4 bacteria causing genital ulcer, 28 plus 4, 32. 32. Sir, here we have seen 4 viruses with clinical manifestations, 32 plus 4, 36. 36. So lab diagnosis. So lab diagnosis of all viruses we have seen. Lab diagnosis of all viruses we have seen. Right? All viruses. Right? I just count it as 1. 36 plus 1, 7. 7. Don't forget the NKPs for lab diagnosis of viral infection. Okay, 7. Then treatment for 4. Okay, treatment for 4 viruses. But this just treatment you have discussed, so I consider it as 1. Right? 38. 38. Then, sir, 2 plus 2, 4 fungal infections we have discussed, 38 plus 4, 42, 42. So then 3 acid-fast bacteria, 42 plus 3, 45, 45. Then 3 blood and tissue protozoal infection. Sir, 45 plus 3, 45 plus 3, 48. And then 1 opportunistic, sir, 49. If I round off, sir, we have almost discussed, right? At the end, I want to say that we have almost discussed 50 organisms. We have almost discussed 50 organisms, right, in this almost 1.5 hour session. Almost 1.5 hour session. Hope you enjoyed the session, guys. If you really enjoyed, give me a high five. Right? Hope you feel it's a wow session or yo session, right? And it was a full energetic session with full information, and all the very important topics are covered which are needed for INICET. And it is covered in a better manner like you have not seen in your life so far, that we can learn microbiology like this. If you feel, okay, how is this session, I want you to comment. I want you to comment in the comment session. So this what session will be there in the YouTube till the INICET, right? That is what I think. I'm not sure. I think this session will be there in the YouTube for INICET. I want you to comment really how the session was, right? How the session was. How did you feel, right? If you feel awesome, then yes, please, awesome. If you feel okay, then please write okay. When you write okay, please tell me what better I could have done so that I can improve further. If you feel the class was not good, then write class is not good. But when you write class is not good, please tell me why it was not good and how can I make it better next time. See, whenever you say okay or not good, you have to say if you have felt like this. But along with that, what can be done to improve the class, so that I can understand you what is the problem with you, so that I can come up with the future sessions the way you want, so that it will get benefited, right? So there are 12 topics. But we have covered almost 50 organisms, and all these things are very, very important for INICET. So with that, I just pray to God that, right, so exam preparation will get simplified for you people, right? Because I know the content is very vast. It's not so easy, right? It will get simplified for you. And I pray to God that all of you, right, get your dream seat in your dream college, right? So that is difficult, I know. I can pray. After that, it is your efforts how you are going to put. And always remember, prepare well, prepare smart. That everybody will tell you prepare well, but along with that, you should have to prepare smart. That is important. Why? Because the content is vast. You can't cover everything. You can't remember everything. You can't answer everything, right? Sir, covering, remembering, answering is difficult. That's why you have to start with the important topics. You have to be thorough with the important topics, and you have to see my questions are getting right or wrong. If they're getting wrong, you have to see why they're getting wrong even after reading, and you have to correct your mistakes, and you have to bring down the wrong answers, and you have to bring up the right answers. Man, you have to work on covering the content. You have to work on remembering the content. You have to work on understanding the content. You have to work on bringing down the wrong answers. You have to work on, right, bringing up the right answers. Sir, everything is important. Everything is important, right? Everything is important. So that's why I want to say at the end, prepare well, prepare smart. Sir, somebody is asking the PDF. Sorry guys, this PDF is not available. This PDF is not available. Sir, here only 12 topics are there. You can see and you can write down. Sorry for that. This PDF is not available. And second thing is, right, if you have any doubts, yes, you are welcome. You can find me in social media with Dr. Blueprint. Okay, Dr. Blue, sir, E is not there. BLU, that's it. Blue, BLU, PRINT. Okay, E is not there. Sir, if you type Blueprint, Dr. Blueprint in Google, you will get the right Instagram and YouTube channel and all. In Telegram channel also, if you want, in the Telegram, you just have to write Dr. Blueprint, right? So if you write Dr. Blueprint, you will find my Telegram group channel and YouTube channel and also Insta, whatever it is. You can contact me regarding any doubts if you have related to microbiology. Sir, you are always welcome. And at the end, what I want to say is, now, right, just in 2 minutes, I will wind up this session. Sir, from now till the INICET exam, what to do for the students who have started our preparation? What to do from now till the INICET exam? Sir, for that you have to understand that there are different kind of students are there at this moment. Few students, they have completed their face-to-face coaching, Completed means they have completed all entire course. They have completed all the 19 subjects. Those have attended face-to-face classes. But there are few students who joined late for the face-to-face classes. They have completed half of the subjects. Still half of the subjects are pending. And there are few students who are preparing from the app. Right? Here also we have two kind of students. Those who have completed already all 19 subjects, and few people they are still have done half of the things from the app. Sir, whatever it is, whether you are attending face-to-face classes or whether you are attending from the app, from wherever you are attending, right, whichever may be the platform, we have two kind of students. One type of students have completed all the 19 subjects, the classes, and another group of people who are still completing the classes. So there are two types of students. First, I want to tell the people who have already completed. So the people who have already completed 19 subjects, for them what I want to say is, if you are confident in all the 19 subjects, if you think you remember and if you think you can crack this upcoming INICET exam, then obviously you have to revise all the 19 subjects and you have to go to the exam. There is no other thing to tell there, because you are confident. You think you are remembering all the 19 subjects because you have already revised 1, 2 or 3 times, right? If you have revised 2 or 3 times already 19 subjects, sir, are you kidding? Man, those kind of students will be there. You don't know, I know. I'm teaching from past 7 years. So those who have completed all the 19 subjects, 2 to 3 revisions got over. You have confidence that I can cover everything. I can not only cover all the 19 subjects, I remember all the 19 subjects, and I have given the GTs. In my GTs, my score is right 550, 600. My 4 is 550 to 600. Right? Then you have to revise all the 19 subjects and go. So this is the first type of students who have completed all the 19 subjects, revised 1 or 2 times already, and now they have to revise all the 19 subjects, go and give the exam. Right? All the best. I pray to God that you will get, right, that you will get the seat in this exam. So second type of students just now finished all the 19 subjects but not revised. Just now finished all the 19 subjects, not revised. For these kind of students, what I want to tell is, don't run behind covering all the 19 subjects. Remember, this is INICET exam. Right? This is a little difficult exam. Second, remember, you have less time, 1 month. In 1 month, you can't cover all the 19 subjects. Then remember, INICET exam is having less number of seats. So if you try to cover all the 19 subjects, it is not possible to cover all the 19 subjects. Even if you cover all the 19 subjects, you can't remember all the 19 subjects, all the things what I've read in all the 19 subjects. Right? So for that, what I want to tell is the students who have just completed the course but not given even a single revision, study 4 to 5 subjects thoroughly, go and give the NEET INICET exam. Study 4 to 5 subjects thoroughly, go and give the INICET exam. And your aim should be, in this INICET exam, from these 4 to 5 subjects, my questions should not go wrong. From these 4 to 5 subjects, my questions should not go wrong. That is your aim. So with that, what happens is, by keeping INICET exam as a target, you are covering 4 to 5 subjects thoroughly, so that after INICET, those 5 subjects ka burden is reduced from your head, and you have only 14 subjects to revise for the upcoming NEET exam. I'm not telling that you can't make this INICET exam. It is very difficult to crack this upcoming INICET exam. I am telling you people, read 4 to 5 subjects thoroughly for this INICET, so that at least 4 to 5 subjects are done thoroughly till INICET. After that, you have only 14 subjects to revise. Then you revise the 14 subjects. Then you target for next May INICET exam. You have an opportunity. You target for next May INICET exam, because your NEET exam will be somewhere around April, May or June. Right, somewhere April or May. I feel your exam will be somewhere April or May. Right? That is what my gut feeling. Anything can happen in India. Right? It can happen anytime. But what we see, somewhere it will be around March, April or May. Exam will be somewhere around March, April or May. So you are going to get a chance of another INICET exam. Don't forget that. Right? Don't forget that. If you have completed all the 19 subjects and you are planning to read all the 19 subjects for this November INICET in 1 month, sir, what will happen is you just run through all the 19 subjects, and after INICET, if you won't get the seat, still all the 19 subjects are pending to revise. That will create a lot of burden and saturation to your brain. That's why target 4 to 5 subjects thoroughly, so that at least 4 to 5 subjects the burden will come down. After that, you can prepare thoroughly. You will get a chance for NEET and also May INICET. And third type of students who are still completing the classes, still classes are going on, or half of the classes got over, half of the subjects got over, still half of the subjects are there. These kind of students, what I say is, focus on the subjects which are going on. Focus on the subjects which are going on and prepare those subjects, go and give the INICET exam. Focus on the subjects which are going on, prepare and give the upcoming INICET exam. So 3 types of students. First type, you have completed all the 19 subjects, already revised 1 or 2 times. They have confidence that they can revise and they can get the seat. For them, revise all the 19 subjects, go and give the exam. Second type of students, just now completed all the 19 subjects, not yet revised. For them, my suggestion is don't try to cover all the 19 subjects. Target for 4 to 5 subjects. Cover them thoroughly and target for next May INICET and the NEET exam. And those students whose coaching is still going on or preparation is still going on, you concentrate on the ongoing subjects, and go and give the INICET exam. Go and give the INICET exam. This is what you can do. So I have given a brief idea what can be done. Again, what I have given is my opinion and my suggestion. Final decision is yours. Okay. As a faculty, I have guided you people based on your the stage of preparation, what to do for this upcoming INICET. After INICET, what to do, I will tell you with my upcoming sessions. Okay, you can be in touch with me in the Telegram group. Telegram group is the most common mode of contact with me. You can be in touch with my Telegram group. And I told you for Telegram group, you just go to the Telegram, write Dr. Blueprint or Dr. Abdul Naseer will get the group. You can join. Be in touch, and further I can conduct future sessions. I will tell you how to prepare after INICET, but at least from now till INICET, how to prepare, I have told you people. With that, guys, prepare well, put your maximum efforts like you have never put so far in your life, because this is the time which is going to decide your entire future. This is the time which will decide your entire future. If you get a seat in a branch in which you are not interested, you should be with that branch for your entire life. If you get a seat in the branch in which you are interested, you will be with that field in which you are interested for your entire life. Don't take this entrance preparation stage for granted, right? Yeno ondo marta idivi, right? कुछ तो हम कर रहे हैं यार, सब लोग कर रहे हैं, हम भी कर रहे हैं, पढ़ रहे हैं नहीं यार. Not that is not how you have to read. Sir, what am I covering? Am I understanding? What am I covering? Am I remembering? If not, then how to remember? Right? What I am covering, from that my questions are getting right or wrong. If I am reading something and my questions are not getting right, what is the use of reading? Sir, while reading you have to understand, while reading you have to put efforts to remember, while reading you have to see your questions are getting right or wrong. If you're not doing all these things, you are just reading and completing the content, and that is not a wise preparation. Right? For that you require dedication, interest, that I have to do. I want to get a seat in the field in which I am interested. I don't want to get a seat, forced to take a seat in the field in which I'm not interested because of my bad rank. That should not happen in my life. Guys, put your maximum efforts in this preparation, because this preparation, this stage will decide your entire future. Don't take it lightly or granted. I always tell the students who take this phase, entrance preparation phase, lightly and granted, I feel they are the foolish people, because they're playing with their entire upcoming future. So with that, all the best for your preparation. Like I said at the end, prepare well, prepare smart. Hope you enjoyed the session of microbiology. And from my side, all the best. Bye bye. See you. Thank you. Should we watch the high yield topics? Okay, yes, you can watch the high yield topics. Very important. Okay, don't forget to comment whatever you feel. Awesome to awesome, and okay to what better can be done, and not okay to what was bad, and how I can improve myself. Everything. Bye bye. See you. Good night.